Now, move on to the next slide. What you should maybe pause and think about is that you haven't said the magic word, and that's why they haven't moved you on in terms of asking for the correct exam or asking the right question or asking for the right lab test, for example. So sometimes it's hard to figure out what is the magic word. Now, with that being said, you don't want to fish for information or ask too many questions of the examiner. If it's a straightforward open-ended question, for example, how to perform a subjective manifest refraction using the phoropter, don't start asking for fluorescein angiography or an ICG because it has no relevance to the question that is being asked. And there obviously are going to be oral board questions and scenarios that they're going to present where you may have to ask for the correct test, like a visual field, like a fluorescein, like a refraction. And so the key here is sometimes to be able to ask for the right information, but not fish for information or ask too many questions of the examiner lest you incur their wrath. And finally, if you're polite, sincere, and show you're making an effort, most people will help you. Don't hold me to this. But in general, even if you are a baseline asshole, if you can just kind of fake it for a few hours, most people, by and large, will be nice to you because they want you to get through it. They know all the hard work you've put in. Don't hold me to this because I have heard of some horror stories of students and some of the experiences that they've had with examiners. But I think in general, again, this just is very simple, basic stuff. But if you're polite, sincere, and show that you're making a sincere effort, I think the examiners will try to help you, without being too biased. Since 2018, the examiners are reading the questions now. That's what we've been told. And so what that means is that eats up some of your time when you're in that room for 30 minutes, that if your examiner is reading the question very slowly, that will eat up some of the time. So sort of keep that in mind. Unfortunately, I don't, can't help you there, but just sort of keep that in mind. And what I can help you with is to tell people that you don't have to necessarily get through all 10 questions within a room. Remember, it's quality over quantity. If you get through 7 or 8 questions, but you crush every single aspect of that question, you will have passed that room. A lot of students have this idea that I have to get through all 10 questions, and so as a result, you may kind of inadvertently cut corners or skip something that is super important that may end up making you miss that question, or even worse, may make you sort of fail that room and win a return ticket back the next year. And you don't want to have a return ticket back the next year. As far as, I always get this question and sort of this comment from people who are not in anterior segment, so especially our beloved posterior segment colleagues. People will tell me, I'm retina, I don't do refractions, I don't know what I need to know about optics. The key here is to forget about your specialty for one weekend. It doesn't matter what subspecialty you are. For the purposes of the oral boards, they're going to assume that you have a comprehensive ophthalmology practice. So you have to at least be able to talk about optical principles and some of the things that are going to be needed for what a standard of care for clinical and surgical practice. So again, if you're a retina person or a peds person, they're not going to suddenly wheel in a patient and ask you to do cataract surgery and put in a certain premium IOL and you have no idea which one to put in. That's not how this usually works. So they're going to ask you stuff that is related to what a comprehensive community-based ophthalmologist should know. So forget about your specialty for one weekend. Now, on the day of the oral board exam, understand that you have the following jobs, especially in the optics room. You cannot delegate or refer them out. So you have to be the following things all at the same time. So in addition to being an ophthalmologist, you have to be an optometrist. So that means you will have questions on glasses and contact lenses. You'll have to be an optician. So you may have questions about how to properly fix and troubleshoot the fit or the aesthetics of a patient's glasses. In the peds room, you'll have to maybe be an orthoptist, or the neuro room, you have to know how to do the orthoptic exam. The other big one here, as far as for the oral boards for the optics room, is that if you have a patient where they're asking you to discuss low vision options, please do not tell them that you're going to refer them to a low vision specialist. Now, obviously in real life, that's what you're going to do. You're going to refer them to